Hi everyone, this is Laura Billingsley. I'm one of the nurse practitioners here at Village Health Partners. I've been working in family practice for 15 years, with 13 of those years here at Village Health. I wanted to spend a few minutes with you today discussing melanoma. May was Melanoma Awareness Month. I'm very passionate about this topic as melanoma is something I have battled repeatedly in my own life. And my diagnosis has just completely changed the way I take care of myself and my patients. With it being summertime and everyone spending more time outdoors, at the beach, the lake, I thought this would be an appropriate time to educate those of you who may not be familiar with melanoma. Melanoma is the most deadly form of skin cancer. I'll often get comments from patients or others that, hey, it's just skin cancer, right? It's not that big of a deal. It can just be removed or scraped off and I'll move on with my life. While melanoma can be removed, it has to be surgically removed. And what some don't realize is that higher stages of melanoma, it can metastasize, spread to other organs, and be quite serious, even life-threatening. 2 people die every hour from melanoma. Melanoma is the 5th most common cancer in men and women and one of the most common cancers in young adults. Everyone is at risk, even children. This sneaky cancer doesn't discriminate. No one is exempt. Your risk for developing melanoma does increase as you age. Use of tanning beds, or having a previous skin cancer history of like basal or squamous cell, having a weakened immune system or compromised immune system are all risk factors for developing melanoma. Having 5 or more childhood sunburns or 1 blistering sunburn in your lifetime doubles your risk. Having a family member that's got melanoma or another skin cancer increases your risk. So I highly encourage you, if you have a first-degree relative with any skin cancer history, go get your skin checked. Melanoma can occur more commonly in men versus women, and in men, it's typically seen on the trunk, the head, or neck, and in women, it's most commonly seen on the legs. Prevention really is key here. The best way to prevent melanoma is to get screened regularly by a clinician and check yourself regularly. Melanoma looks like a very dark, irregular shaped mole most of the time. It can be any size, although often it's as big as a pencil eraser. It can be even a mole you've had your whole life and then all of a sudden changes. If you notice any mole changing in size or color, or it starts to crust or bleed or itch where it never did before, go get it checked. See your local dermatologist or come see us at VHP and we can do an initial screen for you. Another way to prevent it is to use the appropriate sunblock. You need sunblock that is at least SPF 50 or higher, and make sure you reapply every 2 hours at a minimum. There's not a specific brand that you need, but you do want to make sure that it blocks both UVA and UVB rays. SPF clothing and wide-brimmed hats are also great tools for prevention and protection. While melanoma is very serious, the 5-year survival rate is really good at 93% if it's an early stage. Fortunately, the survival rate drops to 66% if the melanoma has spread to your organs. So my take-home point here is just be your own advocate. Don't ignore changing moles or put off your skin screen for another year. If you think something looks new or different, ask your doctor. Skin screenings should be a routine part of your health maintenance, like a physical, teeth cleanings, and vision exams. I look at every one of my patients' backs and their skin when they come to see me. If you ever want to hear more about melanoma or my journey, I'd be happy to share with you. Talk to your PCP here at Village Health today with any questions on this, or feel free to message me directly on our portal. Happy summer, everyone.